Joining us as we launch the very first um, webinar of our DermaGlam educational series with you today. We're very excited. My name is Anushka Sepera, and I'm the clinic director and skincare specialist at DermaGlam Clinic. And along with me is my colleague, Ms. Nilufar Ahanchin. She is our expert medical esthetician and skincare specialist. And we have a special guest speaker today. She's joining us shortly, and her name is Ms. Dina Martins. She is an expert in the industry for skincare and medical esthetician, and she's been also consulting with a few medical spas in GTA. She'll be joining us shortly in a couple of minutes. And before we start, I just wanted to welcome everybody and mention that you are free to throw us your questions through the chat channel at any time throughout the webinar, and we'll be glad to as we go along. So we'll be pausing and answering and going with the flow of your questions. So just wanted to mention that I hope everyone is, first of all, keeping healthy and safe. Today's topic will be mainly on how to look after your skin during quarantine. And as I said, we're going through uncertain times with the current challenging situation of being isolated and stuck at home for long hours. And we are trying absolutely everything to keep our skin health and look after ourselves. Because when we look good, we feel good. So to do that, we have gathered here to give you a few useful skincare tips at home. So this way, by sharing our skincare solutions, you can tackle some of your skincare challenges. And hopefully we'll answer most of your questions throughout this webinar. Before I start, I wanted to just let you know that each of us will share our personal stories and tell you a few tips that we have been using at home to continue the treatments that we used to get at the clinic and we don't have access to anymore. And that way we can at least guide you in your direction of what to do with your skincare at home. And hopefully we'll answer most of your concerns. My personal situation started a few years ago with hyperpigmentation. Hyperpigmentation is basically some darkening of the skin on the surface of my skin. So I would have patches or spots, sometimes appearing and sometimes they go away. So these spots often appeared from sun damage or throughout, of course, aging process. And they got worse and worse. And to get them basically treated, I had to be at the clinic regularly getting my chemical peel. And chemical peels are very effective because basically they're an exfoliation mechanism. They're very effective to remove the surface skin cells that are dead and just keratinizing on top of each other, making this buildup of rough skin surface which you can easily remove by doing the exfoliation through chemical peels. And from that, you're enhancing your, of course, cellular turnover, which means bringing the healthier skin right up to the surface of your skin and giving you that brighter and healthier glow that we're all looking for. So to do that, I regularly attended my chemical peel sessions and my results were amazing. And I prepped my skin, of course, to do other things in order to treat the underlying issues with hyperpigmentation. And I tell you, hyperpigmentation is triggered not only by external events such as the sun UV rays or heat or damage to your skin or burns, but also by internal hormonal issues that could arise from stress that we're all enduring at this present time. So anyways, to make this story short, I prep my skin usually with exfoliation mechanism. And at home right now, I don't have access to chemical peels. So what I do currently is I use my enzymatic peel from the award-winning skincare line, Illumia MD. This is a medical grade skincare. And this particular peel that I use called enzymatic peel is basically an exfoliation mask and the strongest at-home chemical peel that you could find on the market. It's very safe to use. And what I do, I usually apply it 2 to 3 times a week, only in the evenings for 3 to 5 minutes. And then I gently wash it off. So depending on your skin type, you can maybe reduce or increase the time. And I usually go to 10 minutes because my skin endures it for that. So you can try and see. It's a very effective chemical peel, and a lot of our clients are very, very happy with results when they use it at home. Because remember, even if you do peels in the clinic, you still need to maintain it at home with your skincare routine. So this was a great supplement to my chemical peels. And once we exfoliate the outer layer of skin, where it's basically dead and accumulated, we call it hyperkeratinization. So it's a buildup of all these dead skin cells. Then we have that fresh, supple cellular turnover, which happens and comes to the surface. And now we need to be treating what's causing the underlying basically the pigmentation process. And that is from the underlying lower epidermis layers, because that's where the pigment comes from and where it's generated and gradually moves up to the surface, creating the spots or the pigmentation that we generally see with the naked eye. So to tackle that, once we exfoliate, now we made the skin prepped up and easy to penetrate any treatment. And I use my brightening solution, which is called the Even Tone. And this Even Tone serum is applied usually evening and morning, right after you cleanse your skin and make it ready. And this goes right in to basically turn off or shut off the pigmentation process. So that melanogenesis process, where we have the pigments coming and generating and getting released into the cells, is being stopped and shut off through this particular treatment. So it's very effective because you don't want to just treat the outside layer of your skin, but you want to also address the underlying cause of your pigmentation, which is to turn off that melanogenesis cycle. And then on top of everything, when I do my treatments, I have to protect it, because if I don't protect my skin again and I get exposed to any source of light, it could be indoor or outdoor, I get my pigmentation again coming back. And that is a very normal skin response. Pigmentation process is basically a way of your skin protecting itself against damage, which is coming from, the UV lights or other sources to your skin DNA. So in order to protect, we have to have a broad spectrum sun protection. And I use a very popular sunscreen called Sheer Hydration. And this is also offered through Alumier MD. It has ingredients that are also conditioning your skin and anti-aging. So it doesn't make me dry, because as we age, we get drier. And this helps really with that. And I don't really need to apply that much of a moisturizer to get my, flawless skin for the day. So this is a good finishing product that I use these days. It's my Bible. It basically attached to me. When I go in my basement, I apply it. When I go upstairs where there's more daylight, I apply it. When I go outside, I have it in my purse. So make sure you always carry it with you. And it's the cheapest way to tackle your hyperpigmentation, because you're preventing it in the first place. So I think I talked enough. I need to get room to the ladies who are sitting impatiently to get to their issues. I hope that I helped a few of you with hyperpigmentation challenges. And I'm going to pass the floor to Nilu now to share with us her solutions.
Hi, everyone, and thanks for joining our first webinar. So yes, we are in quarantine and we're having different challenges. Everyone has their own skin challenge, of course. So this skin challenge that I've been having since quarantine, and even before that, it was of course my acne scars. So I suffered a lot from acne when I was a teenager. So after they were gone, so they left a lot of pitted scars in my skin, and I've been struggling to fix them. And one of the great solutions that I found, of course, at the clinic was microneedling. So it's also called a vampire facial, with the needles going through your skin and damaging the skin. But that's a fake damage, because that causes all the collagen synthesis and production after your skin is healed. So it's really amazing for your skin. And also PRP, of course. But since I'm home these days, there's no way to go to the clinic and do them. So I use my home care stuff, home care skincare products. One of my favorite skincare products that I'm applying is a physical or mechanical exfoliant. It's called Lotus Scrub. So I love this because it's very different from all the pharmacy products. The granules are so nice and smooth on your skin, but also I apply it on a dry skin. So I apply it and then rub it on for a minute. It increases circulation and blood flow to your skin because we don't really massage our skin as we're home and we're stressed, and so there's a lot of decrease in blood circulation. So that actually helps bring blood circulation on your skin. So I use it depending on your skin. Some people use it every other night, and some people use it twice or 3 times a week. I use it personally 3 times at night, 3 times a week at night, and not every night. One of my other favorite products that I use from Illumia is actually it's vitamin C and E plus a peptide. So I love this because vitamin C oxidizes by itself. So you've probably seen vitamin C when it's exposed to sun, or when it's exposed to the air. When we open the bottle and close it all the time, it gets that orange, yellowish color. But Illumia is very smart. They came with this beautiful package. So where vitamin C is, it's formed in a powder, and you're a chemist at home. So when you actually when you squeeze the bottle, I can show you after, or Dina can show you actually. It's fresh. It gets mixed to vitamin E gel. So then you have it fresh for a month. That's why it's very small, and it has a peptide in it. So it's matrixyl synthesis. It's an amazing peptide. It targets aging, wrinkles and fine lines and wrinkles. Because I'm 30, I have to protect my skin. But above all, I love it because it works from inside out, and it stimulates your collagen production. And it's also a great antioxidant, because we're always on the phone, or we're also on our screen all the time. We need something to battle all the free radicals. Right? So at night, what I do, I use a retinol. It's 1% retinol because my tolerance for retinol has gone up right now. But I started with 0.25 and it upgraded to 1% right now. So retinol, it's really amazing. It's for brightening, aging. But as I said, for my acne scars, it works from inside out. So since I can't do microneedling right now, so I'm trying to use production from inside out. It's really important to use this at night because it's very sensitive to sunlight. So for that reason, I use my sunscreen always, always, always. So I use Moisture Matte. So Anushka uses a sheer hydration, but because I have an oily T-zone, so I make sure I use my Moisture Matte because it's really popular amongst youth, and it covers all my pores. It covers my pitted acne scars, and I love it. It's amazing. It comes in different shades. So I use the sand one. It's a broader spectrum SPF, and it doesn't get absorbed into your skin. It reflects the sun rays rather than absorbing the sun rays, so it's not damaging. So using retinol and vitamin C and E and all of that and exfoliant can be a little bit drying to your skin. So it's really important that you use it alongside with your moisturizer. So I use Hydro Dew. It's not really light, so it has that I can show you. It's a little bit not too rich, not too light. I like it because since I'm using retinol 1%, I like to keep my skin hydrated. So that's what I'm doing for right now. But as I get back to the clinic, I can't wait to get my microneedling done again. So I'll pass it to Dina. Sorry I spoke fast because we only have 30 to 40 minutes.
Hi, everyone. Thank you, ladies. I want to first take a moment to thank you for inviting me on. Before I get started with my little blurb, if anyone on the call has any questions, if you are experiencing any challenges with your skin and would like to get some advice, please feel free to make comments in the chat box. We have someone who will be taking a look, and one of us will be answering your questions. So as I get into my talk, please do that. Please make sure that you're writing in your comments and your experiences with your skin into the chat box right now. So Nilu had alluded to the vitamin C And it is something that I am going to be talking about because it is one of the pieces in my collection that I'm in love with. But before we get into that, skin survival during quarantine is a must. And we have no idea how much longer the phasing out of quarantine and getting back to what our new normal could be will take. So we need to make sure that even though our routines have changed, that we're not really changing our skincare routine, because taking care of our skin really is going to give us a renewed and refreshed complexion. And when we're looking good, we're feeling good about ourselves. So it's very important that we keep that up. So with my skin, what I've been noticing, like many other people, is that my skin's been feeling a little bit drier on the itchy side almost. And there's so many factors that can be contributing to that. There are generally 5 things that we are undergoing right now while we are in self-isolation that could contribute to having our skin react in ways that they usually don't. So first of all, we're being closed off, we're indoors. Lack of vitamin D already is something that we experience in our winter months anyway, but not being able to actually physically go out and experience a little bit of that sunshine, that sun rays, is really having an effect on our skin. The way that we're sleeping, our sleeping cycles might be changing or might be interrupted. I know with me, it's my sleeping patterns have changed. They're not the same. The same as our eating habits. We might be grazing a little bit more. We might be snacking a little bit more than what we normally are accustomed to. And all of those snack foods really has a contribution to the way that our skin is behaving and the way that our skin acts. And most importantly, it's the stress levels. And we might not think that being in isolation actually causes stress, but it does. It's low-grade stress, but it's chronic. And when you're dealing with high levels of stress within our body, it does have an effect on how your skin is behaving by increasing the inflammation in the skin. So what do? Whether you're experiencing some acne breakouts that is kind of out of the norm, or whether you're experiencing a little bit more redness, more roughness in the skin, or whether you have the itchy, dry skin like I'm experiencing right now, one thing that you have to make sure that you're keeping in focus is you have to increase circulation with the skin. And so doing a good massage, which the ladies had already mentioned before, when you're doing your cleansing, really work it into the skin. Don't be quick about it. Make sure that you're creating kind of like a ritual in your bathroom when you're using your cleanser. That is the first step in really getting all of the other treatment products or products that you have at home to really take effect inside of your skin. One of my favorites to follow up after I've cleansed is called Bright and Clear Solution. And this is my version of the toner. Now, as you can see, we're all lovers of Illumi AMD, and it's for a good reason. They really have a lot of excellent ingredients, high-grade quality ingredients in all of the skin products. And they don't have any parabens, no sulfates, no mineral oils. There isn't any of the synthetic ingredients that you can find with products that you normally find in Shoppers Drug Mart or even Sephora. It's all high-grade, medically sustainable ingredients that are going to do wonders for your skin. So with this particular product, the Bright and Clear, it has alpha hydroxy acid, which really helps to start jump-starting that exfoliation process in the skin. The name of it suggests it's going to leave your skin clear, and it's going to leave your skin bright and glowing. And who doesn't want glowing skin, even in quarantine, right? So the Bright and Clear is what my go-to is. I think I've fallen in love with this even more so now that we're in quarantine. And it's something that I'm going to have in my arsenal for years to come. I do use a variety of different ingredients, different products, depending on what's going on with my skin. But at this time, because I am experiencing a little bit more of the itchiness and the dryness, I'm really falling back heavily on my vitamin C. So Nilu had shown you the vitamin C. It does come in a package like this, which is a beautiful packaging already. And in it, normally there would be 3. As you can see, I use my products. So this is usually the case that it comes in, and there is a dropper that you would be using with it. But I'm going to show you how it works, because I think it's important for you all to understand how unique this vitamin C really is. So Nilu had shown earlier, hers already had the cap in. So I'm just about to start my fresh new one. And before I was going to open it up this morning, and I realized I can't do it. I got to show you guys all how to use this product online. So this is going to be in live demonstration. So, I'm going to take off this plastic bit right over here. The goodness is separated into two different parts. The top portion is where it's housing all of the vitamin C in powder form. There's a lot of different vitamin C's that are out there in the market, but what I really want you to consider is looking for a vitamin C that has L-ascorbic acid. With Illumier MD, they use 15% of pure L-ascorbic acid, and because it's in powder form right now, it's only going to be activated as soon as I press this cap and it drops into the bottle, which means every single time that I'm using one of these bottles, it's fresh vitamin C on my skin, which means that it hasn't gone bad. It's going to be taking its effect and working its magic on my skin. Right inside of the bottle is the vitamin E together with the peptides. So this liquid is going to really just take the vitamin C and we're going to shake it up, combine it all together, and it's going to be pure goodness for your skin. It is a little bit on the strong side when you're pressing down. You have to use a little bit of pressure. So right now, I don't know if you can tell that right now is closed. And I'm going to press down. I hope that I can do this live on TV. And we're going to, I got to use a little bit of muscle. Sorry, as I press this down, it does take a little bit of doing. So as you press down, you can see that the cap falls in. So as the cap falls in, it is now open and it is released. Can you tell that that has opened up? And now the vitamin C has gone into the liquid. So I'm going to give this just a good shake before I put in my dropper. And this is really going to start activating, blending. It's going to synergize the vitamin C, the L-ascorbic acid at 15% into our vitamin E and into our peptide liquid. Peptides are the collagen blessing for our skin. This is what's going to really start keeping the skin in good form. It's going to keep the structure very strong. And collagen is the foundation that keeps our skin looking youthful. We want it to be as strong as possible for as long as we can. So now we're going to just keep this. This here, you're going to use for the other two bottles. So you would never throw that out. You're going to throw this cap away. And then you're going to just continue shaking it. And when you need it, that's when you're going to be using 1 or 2 drops. And you can see that the liquid is clear. It hasn't churned. It's not brown, it hasn't oxidized. It's very light in texture. And when you're using it, you're going to use it all over your face, with the exception of your eyes. I wouldn't be putting it too close around your eye area, but this is going to help to strengthen your skin. It's going to start really filtering out any of the pollution, and even you might think your home doesn't have pollution, but still does have a little bit, in combination with any blue light that you're getting from your screens, from your devices. Because I know if you're like me, you're on your screens a lot more now during quarantine. So this is going to help to filter. It's not going to become like a sunblock, but it is going to filter it out. So I hope that I've expressed how much I'm in love with vitamin C.
Can I ask you a question?
Yes, absolutely.
And the power of vitamin C as a great filter against pollution and also UV. Can you tell us, if we use it together with our sunscreen, what's going to happen?
Well, just impacts it even more. It's just going to give you double of the protection. So vitamin C is an antioxidant. Well, actually, vitamin C and vitamin E are the 2 most powerful antioxidants that is readily available for our bodies to accept, so that our skin cells, both of those antioxidants are going to fight off any free radicals, which are any substance, any toxic ingredients, anything that we do in our lifestyle that is not great for our skins. It's going to fight it off and protect the skin. So when you're using a strong antioxidant, especially like a combination of vitamin C and E, And then you're going to be using on top of that your SPF. You're just giving yourself that extra layer of protection where you're going to have a more supple, more youthful, more refreshed complexion. And at the end of the day, we all want our skins to look at its best. So when you're doing the layering of the two, you're just giving yourself more ammunition to protect your skin and stay younger longer.
We do happen to have a much better package.
This is J-Lo's secret. I'm telling you right now, you want J-Lo's glow, you got to do vitamin C and E and protect your skin with sunblock. This is how they do it. The celebrities do it.
Absolutely. And I wanted to see if you have any questions, audience, so we can answer them. There's one question that has come up, and it's about exfoliation. Someone is asking, what are the steps that I use for the exfoliation process? And how often should I exfoliate my skin?
Okay, I'll take it. I'm a big believer in doing exfoliation based on how your skin is needing on a seasonal basis. So right now we're in quarantine. What you have to consider is, how is your skin feeling currently in this moment? If you have some sensitivity to your skin, or if your skin is a little bit thinner in texture, then you're not going to be able to handle doing it as often as someone who has a thicker type of skin. But general rule of thumb is, if you're using a high quality product, such as the Lotus Scrub that Nilu had shown earlier, where the granules are very gentle and they actually disintegrate as you're massaging your face, you can actually do this every single day, whether you're a dry, sensitive skin or even an oilier complexion. So how you would do that would be, first you need to do your cleanser. Your cleanser would be based on what type of skin that you have. Currently right now I'm using a cream-based cleanser because I've got a drier feeling to my skin. So a cream base is just giving me that relief. But give yourself a good massage for a couple of minutes, get that get that circulation going. You want movement in your face so that the blood can really carry the oxygen and the nutrients to your cells. So you want to do that for a good 2 minutes. Then you're going to do your exfoliation. So once you have a clean face, you've washed off your cleanser, you're going to do your exfoliation. Now, you can use this on either a dry skin, or you can moisten it with some little bit of water and dampen it and work that into the skin. How you choose to use it, that really is preference. I actually like to use this dry and really work the skin. Nilu, I believe that you like to use this with some moisture. So how you use it will vary based on your preference, but the idea is, work the areas where you tend to have more oil buildup. So for me, my nose accumulates blackheads very easily and very quickly. So I know that I have to pay extra tender, loving care to those areas. So really working in the crevices, especially with my Lotus Scrub. I use then a hot towel, nothing that's too hot, you don't want to burn yourself, but just running a face cloth under the hot tap and wringing it out and putting it on top of your face and just breathing in the steam for just a few minutes. That is going to create a calmness to your skin, but it's also going to help to open up your pores a little bit more. And then using that washcloth, you're going to use that as an additional exfoliator for your skin. Be gentle, you don't want to be rough. The product itself is enough for you to do the exfoliation. What you want to do is rinse off the scrub with your face cloth and just give it a little bit of a helping hand. So not too rough with your face cloth.
I have a follow-up question with regards to what you're explaining. So people with rosacea, how would they react to this type of exfoliation? Are they able to use the scrub?
This particular scrub, yes, 100%. If you suffer from rosacea or from any kind of broken vessels, if you have a lot of redness in your skin, you do have to pay a little bit more attention and stay on more of a gentle side. And you're gonna love the Lotus Scrub because it is so gentle. As I said earlier, the little beads, they're spherical in nature. And when you're working it into the skin, there is no scratching involved. The product itself disintegrates on top of the skin. So it almost feels as if the little beads, they kind of break apart before you actually get any kind of a scratching action. But it is so effective in getting rid of the dead skin cells. Even with rosacea, you have dead skin buildup. You need to lift that in order for any other products that you're using to penetrate properly into your skin. But you do have to pay attention and not aggravate the redness in the skin. So for me, I'm doing this every single night. For someone who has rosacea, you might want to consider doing it maybe 2 to 3 times per week. So monitor your skin, look at how your skin is behaving, and then adjust from there. Your skin will tell you exactly what it needs. You just have to pay attention and listen to it.
Amazing that what you said is true. You have to always listen to your skin. If it needs rest and have a break, you give it that, because it needs to recuperate in order to get to the next level. So we have to always watch how our skin reacts.
Right, absolutely. Now, just to kind of finish off with the process of the exfoliation, I am going to suggest that when you're doing your exfoliator, do it at night, because this way, when you're going to bed, your body is going through a regeneration process. It is healing. It is repairing itself at night. And when you're going to bed, you want to make sure that all of the dead skin is off and all of your good products, all of your good ingredients, the nourishment that your skin needs is going to be on top on clean, freshly exfoliated skin. So I just wanted to finish that off before we move on to the next question.
And just to add to your exfoliation with the scrub, physical scrub, I wanted to mention that the enzymatic peel that I use is also safe to be used with people of rosacea or sensitive skin. They just have to put it for less amount of time and watch their skin, how they react to it. And if they feel sensitivity, they can wash it off sooner than later and maybe use it less often during the week, maybe once a week rather than 2 to 3 times. So that's another point I wanted to add. Absolutely.
So for clients who have rosacea, I don't have a bottle of it with me right now, but they do carry, Illumia AMD does carry a product called Calm R. It's not an exfoliation product, but it is a product that will help to reduce the level of inflammation that's in the skin and really start reducing the redness that's associated with rosacea. So if you are experiencing rosacea, I know that that's not, it's not a very pleasant experience to be going through. I have quite a few clients who've experienced that, and they suffered with rosacea for a very long time, and all they wanted really was something to kind of calm that redness. So just keep in mind that there is a product called Calm R. If you are a rosacea sufferer, that you might want to look into that, because that really would help in starting to reduce the redness and start calming that inflammation for you.
We have a complete collection of calming and soothing and therapeutic products from Illumia that helps for cleansing, for moisturizing, for serum treatment, and of course our protection with the sunblock is for all skin types. So if anyone is needing that, we have a whole collection that they could reach us for. I wanted to have Neil bring up a promotion that we're running right now with regards to our skincare line, Illumia AMD.
So if anyone is interested to buy Illumia AMD products, if they spend over $300, we can offer them a free ultrasound, signature ultrasound facial. So what ultrasound does, when I'm doing facial on people, of course, the product get absorbed better with an ultrasound. There's a hot and cold ends to it. So the poles, first I use the hot pole to open up the pores, so it allows the better penetration of products. Then I close the pores with the cold pole. So it's an amazing experience. If you guys haven't used it before, it's really, really nice. But let us know if you're interested to purchase Illumia products. We're ready to help you.
And is it safe on all skin types?
It is safe on skin types, but the ingredients and the products I'm using on people, it's going to be different. Like if someone is experiencing rosacea, I'm not going to use a very, very hot pole. So I can actually upgrade the heat of the pole. So yeah, I can adjust it.
Amazing. So it was a pleasure having all of you here today on our very first educational webinar. I personally enjoyed it. I hope you all enjoyed it and learned from our very best Gina Martins, our very best Nilufar. hope I was some of help to you all. And we would like to repeat this again on a regular basis. So please join us for the future webinars. And if you have any questions or concerns, we're always available. Our phone number at the clinic is 416-901-0702. And of course, our email address, info@dermaglamclinic.ca, is at your disposal. So please reach out to us. We're available. We're answering our phones. We're answering our emails on a spare of the moment, and we'll be happy to assist with any concerns during this isolation time. So on behalf of everyone here and also our DermaGlam staff, I'd like to thank everyone for your help, especially Jerry in the background, who is not visible on the screen, but we thank you very much for your support, as well as Dina Martins and Nilufar Ahanchin. We'll talk soon and have a very safe and healthy few weeks ahead. Hopefully we'll see you soon at the clinic. Take care.
Thank you. Thank you.
Bye,
Bye-bye.
everyone. Bye-bye.